Alliance. Thank you all for taking the time to join us this morning. Today we're going to be discussing the 2013 Challenge Award Request for Proposals, and this will be a question and answer session. I'm going to go through a brief overview of Baby's First Test, a little bit of the history, and then get right down to some questions that I know that we're going to have. It's now noon Eastern, and I want to be respectful of everyone's time that's on the call. So we'll go ahead and get started. If you look on your webinar panel that should have popped up, there's a place where you can type in questions, and those will come directly to me, and I'll get to those in just a few minutes. So feel free to start typing those questions in, and I'll answer them as they come in. So first of all, welcome. Thank you all for joining us. Just a little breakdown of what we're going to be discussing today. Again, a brief overview, some background on the 2011 and 2012 Challenge Awards, our 2013 priorities, some recent questions I've already received via email, and then I'll go ahead and take those questions from the group. Genetic Alliance is a 26-year-old health-focused nonprofit. We really work on improving health through genetics. We originally started out as an umbrella organization for a number of rare disease groups, and we're really expanding to see, in addition to that role, how else we can help the community when it comes to genetics. A few years back, we were awarded a Health Resources and Services Administration grant to create a newborn screening clearinghouse of information. So Genetic Alliance created Baby's First Test to house that clearinghouse, and this has become a center for newborn screening education. We really work hard on making sure that parents have, up-to-date and accurate information, providers have information, researchers, just kind of creating a hub where everyone can come together and find a reliable source. So we are currently starting our 4th year of that 5-year grant. And we have, for the past 2 years, we have had the Challenge Award program. Now, the 2011 and 2012 Challenge Awards, we're really pleased with the products that came out of that, the relationships that we've started. It's been all about really fostering innovative ideas that are in the newborn screening community that help education, outreach, or even just the process of newborn screening. We've partnered with everyone from March of Dimes, the Association of Public Health Laboratories, state regional collaboratives, individual state labs, nonprofits, advocacy groups. We're really open to working with a wide variety of individuals. Different products that have come out of the Challenge Awards have been videos. March of Dimes did a video on how to talk to your patient about newborn screening, which kind of gives parents some ideas on questions they could be asking, gives providers an idea how to start that conversation. Children's Hospital here in DC created a video to discuss pulse oximetry for both parents and providers. The State Hygienic Lab in Iowa created a video to help nurses understand the actual specimen collection for the newborn screening blood spot. We've had hospital-based research on different intervention methods, what's more successful, a follow-up phone call, a video, a pamphlet, that kind of thing, and then outreach to specific groups. We had a great project reaching out to the digital community, Moms Online, really talking with different bloggers and how that would look. So a lot of different ideas reaching out to different areas that we've been really excited about. Summaries of these projects and these videos are available online at Baby's First Test. You can feel free to visit us there. On the bottom right, if you click on Innovation, that'll take you to a screen where you can choose Challenge Awards, and the projects are up from previous years there just to kind of get an idea of what's been going on in the past. Now, if you have talked to anyone from HRSA in the past few years, then there's no doubt that you've heard the mantra data, data, data. And that's no different with Baby's First Test. As a grant-funded organization and a grant-funded project, we really are being held to those same standards of having to really show why this is important and why this is successful and why it should be continued. The Challenge Awards are by far one of our favorite parts of this project And we've had some pretty good success last year getting some data to really show the importance of this information. So as you're putting together your proposal, please consider pre and post project data that can be collected. Whether that's just saying what's the baseline knowledge, what are you hoping to gain, what are you hoping to show. It's going to be really important, and the criteria for grading the proposals was changed to reflect that this year. So there's a larger percentage of the points that are now going to data collection and making sure that this is a really measurable project. Also consider sustainability after the end of the project time period. What is that going to mean? Is it just over? Is it a one-time deal? What will be the sustainability of this project? And then consider the growth potential. Some of these projects have really started out almost as a local trial and really seeing what would this look like if it was expanded nationally. So think about how projects are starting now and how they might look in the future. Recent questions that I've received, one of them is just for the project criteria, the proposal criteria. It must include newborn screening education, or if it's going to be a condition-specific project, it must be a condition that's on the recommended uniform screening panel put out by the Secretary's Advisory Committee on Heritable Disorders in Newborns and Children. Evaluating a condition for inclusion to be a part of newborn screening is not eligible at this time. So if you have any questions about that recommended uniform screening panel, please feel free to reach out to me. It certainly does not need to be a condition-specific project, but if you are looking at an education or outreach or something related to just one condition, it needs to be a part of that RUSP list. That is available on Baby's First Test, but if you have trouble finding it, you can always email me and I can point you to that as well. Eligibility. For the Challenge Awards, we're really looking for organizations, not individuals. If you're an individual looking to get involved, we have our Consumer Task Force program. We had a webinar yesterday about that, which will be posted online later today. But this is really for organizations, whether that's nonprofits, state Department of Health, state labs, hospitals, disease advocacy organizations. All of these kind of organizational groups are eligible to apply. And I think that was the basics of what I wanted to review. If you guys can take a minute, think about any questions you have, and then I can start answering some of those questions as they come up. Are local public health departments eligible to apply? Absolutely. We encourage local public health departments to apply. We had some great progress, working with these departments in the past. So please, we're happy to have local public health departments. Any other questions about the process, the application process? Feel free to ask those now. I'll be happy to answer any of those. I see someone has raised their hand. If you can just click on the question box and then type in your question there, that'll pop up on my screen and I'll be able to see it. Okay, so the RUSP is the Recommended Uniform Screening Panel that has been approved by the Secretary's Advisory Committee on Heritable Disorders in Newborns and Children. It's quite a mouthful, and we have a lot of acronyms involved. And so what the RUSP is that it's a panel of 31 conditions that the federal government recommends that everyone be screened for. Now, newborn screening is absolutely a state-based program, and so every state determines their own panel. But for this project, for this grant, we are really going off of the federal government's recommendations, as it is a federal government grant. And so if a project is going to be focused on one specific condition, we need that to be one of these 31 conditions that's on the RUSP, for the Recommended Uniform Screening Panel. I'm happy if that doesn't answer the question or you have trouble finding that list of conditions. I will be happy to email that to you. If you can just, shoot me an email, elizabeth@babiesfirsttest.org. I'll be happy to send that list over to you. The number of grants that will be awarded is going to depend on the amount of funding that is requested. So we have a set, $100,000 that we will be awarding, up to $20,000 per project. Last year we had a couple of grants that actually requested smaller amounts of funding for different projects, and so we're able to have 6 awardees rather than 5. Not everyone asked for the full amount. So that's really going to depend on the amount of funding that's requested. We kind of rank the projects in order that we feel will have the greatest impact and go through our funding decision from there. So I anticipate at least 4 or 5 will be funded. Does the evaluation of the project time need to be completed within the funded 6-month time frame? Our time frame is actually 9 months. This will be a January through August project, and we would like the evaluation to be pretty well underway within that 9-month time frame. It's just the way we break it down is that different disbursements of the amount awarded are tied in with different deliverables, and that last section of money, that last chunk of money, is tied in with a final report. And so that's kind of how we view that. Total award amount distributed, again, it will be approximately $100,000 with a cap of $20,000 per project. Okay, I think I answered that question about the RUSP. Yes, we are definitely interested in Spanish language resources. I think that's a great idea. The question is, we plan to create a video in Spanish language for the work done for childbirth education, for nurses, midwives, etc. This may be non-specific. Can this qualify for a challenge award? The idea is to use Babies First Test as a platform and reach out to underrepresented populations and address cultural competency. Absolutely. We're definitely looking at different avenues to reach out to underrepresented populations. Cultural competency is a very important thing that we're working on right now. Just to give you an idea of what we're working on, Babies First Test, we are working on a Spanish language version of the site that will be expertly interpreted, not a Google Translate button or anything like that, but really taking the time to make sure that this is a high quality translation and interpretation of all materials available. So I think that's a great idea, and we definitely welcome Spanish language resources. Will any trainings be involved? We can provide technical assistance. There isn't any need to budget for travel. Any kind of conversations that we had would be similar to this, by webinar, by phone. We do typically set up monthly phone calls just to check in, see how things are going. If those phone calls need to be more often or less often, we judge based on the individual project, but there's no actual travel that needs to be budgeted in. The cap for proposals is $20,000, whether that's rural or urban. It doesn't matter. Any project request, the cap for funding would be $20,000 per project. So technical assistance would involve things like how the resource or whatever you put together would be able to be featured on Babies First Test, or other online sources. If it's a video, trying to get it up on all the different platforms. We do not have the capabilities for videography to kind of edit all of the different videos We certainly have worked with some wonderful videographers in the past, and if that comes to be part of the project, I can make some referrals, but that's not something that would be included here. Same with translation services. So sometimes it takes a little more work to get something up on Baby's First Test to have a module created, and we have the capability to help with that as far as, you don't need to find a web developer to see how is this going to fit into the Baby's First Test website. We can take care of that, but not the actual translation of any materials. Now, this is a good question. What sort of data indicators are we looking for? Data is tricky in this arena, especially because, as we all know, about 98% of babies born in the U.S. are screened by newborn screening. The type of data that we would look for, so let me just think of some projects that we have going on and how those are working. So, for example, the Iowa State Department of Health, their lab created a video to help with the newborn screening blood spot collection. What they did is they had a sample of nurses and asked basic questions about the actual collection of the spot, and then requested different questions they had about the process and used that as their baseline information. Kind of got to the misconceptions about the specimen collection from that avenue, and then created the video, and their post data is going back out to these communities, showing the video and seeing if those same misconceptions still exist. And so, it can be anything. We really think about pre-post as an easy way to see an intervention. So at the start of the project, who are you trying to reach? What did they know about the topic that you're trying to inform them about? After they've used your tool or your video or your outreach, are they more aware? Do they have accurate information? Those sorts of things. The strict data indicators that we hear about a lot are really difficult to apply to the newborn screening arena. So we're aware of that, and we're not expecting, really that kind of really hard, concrete data. But we do like numbers. It's easy to show. It's easy to share. So thinking about how that can be applied is always helpful. Can funds be used for printing materials? Absolutely. The funds can be used for anything that you deem necessary for the project. So printing would definitely be included in that. All right, it looks like the questions are slowing down a little bit. Please feel free to keep throwing those out there. I'm going to go ahead and throw up my contact information. If anyone has any questions here, you could just let me know. There's my phone number, 202-966-5557, extension 207, or elizabeth@babiesfirsttest.org. I am working remotely on the West Coast for about another week and a half, and so email really is going to be the best way to reach me these days, but I do try and check my voicemail. But yeah, anything like that is great. I am seeing a hand raised. And, I'm not seeing there is one participant. I can see your hand raised, but I can't see the questions coming through. If maybe you can send those to Tanya or try the chat. Okay, here it is. Is the Baby's First Step available to come out and speak, or do we solely utilize materials, videos? Are the videos available for utilization? Great question. Yes, you can absolutely use all of our videos and materials that we have already created. It's tougher for us to go out and speak if we're already in a specific geographic location for a conference, or if someone's local to DC, that's definitely something we can talk about. But we have not worked in funding for travel to other areas. So it would really be either tying it in with another conference that's there, or thinking about if we could do a webinar or a video chat. I am always happy to jump in on those sorts of of areas, but it is tough for us to travel for specific events. Let's see. Many of the previous grantees made videos, created materials. Are you looking for a tangible end product? You know, sometimes it is helpful. It doesn't necessarily need to be a tangible end product. One thing that comes to mind is that we did an outreach online to different bloggers. We did end up, you know, with several posts from different bloggers across the U.S. who wrote about newborn screening and talked about that. We do look for things that will help reach out to specific communities. I don't know that that's a requirement, but we do want also the project to be sustainable. So thinking about what at the end is going to continue after the 8 or 9 months. So if it's an outreach, you know, how can that outreach be continued? So really kind of thinking about that as well. Back to the question. If the product, video, or educational material is created, can it be shared with the applicant organization's website? Absolutely. And that's a really important kind of key point. Anything that's created for Baby's First Test, by Baby's First Test as part of the clearinghouse, we want to be free of charge, and we want to be widely available. So our videos have been posted on a number of different websites, and we really do want there to be a lot of sharing of this material. We certainly don't want it to only be housed on Baby's First Test. One of the things, after we did see that the videos seemed to be pretty popular and pretty successful in the outreach, we created a quick little, like, I think 5 to 10 second intro that just kind of is a logo basically, and then we try and put that before all of the videos just to kind of give them a more uniform look. That's something that our technical assistance site is absolutely available to help with, kind of incorporating those types of things, or we can send it to you if that's something you feel comfortable with. But yes, feel free to, any materials you see on our website that you want to share or use, absolutely, and we would expect that to continue for any videos or materials produced in the future. We are considering creating a section on our current website that would link to Baby's First Test and would provide a launch point to address specific newborn screening concerns. We'd like to encourage outreach to our clinic contacts as well. Does this sound appropriate? I think that sounds like an appropriate part of a project, and I think it would depend more on how that was going to be fleshed out. We always appreciate people, you know, pointing to Baby's First Test and helping us, you know, kind of be a hub of newborn screening and information and education. So I think it would just kind of depend on how that would look and what your specific ideas were. Just based on the breadth of and the depth of applications we've received in the past, I don't know if a link on a website would be considered as competitive as some of the other applications that we've seen, but I can definitely see that being an important and interesting part as we reach out to different communities. The piece about reaching out to clinic contacts, you know, absolutely. One of the projects that we're working with that's just kind of finishing up right now was, you know, a newborn screening educational tool that was placed in a clinic in Pittsburgh, and it's on a little tablet, and women who are going in for their OB appointments can kind of go through this little module about newborn screening. Again, there's a pre and post test of what they knew coming in, what they knew leaving. Data is still kind of being crunched for that project, but the hope was that it would give you know, women a basis of newborn screening education to have a more in-depth conversation with their provider rather than the first time they're hearing about it. So that kind of involvement in the clinic we absolutely do like, and I think that's a great idea. Anytime you can reach out to clinics is important, because you know, you can have a great resource online, but if it's not being utilized in the communities, you might as well not have it. So I think that's an important and good idea. All right. Any other questions? Let me just check this box. How many applications? I know we received the request for funding, I believe, was close to $400,000 last year. I think we had, and please don't quote me on this, but I believe we had 25 applicants. So that's how many we received last year. I have not been keeping up with the applications this year. They're not due, I believe, until November 9th. So there definitely is some time for there to get those applications in. Unfortunately, we do typically receive, quite a few more applicants than when we're able to fund. I know last year we had a handful that we really wish, we'd had some additional funding to be able to engage with. So it's just been wonderful quality of applications and kind of really exciting projects. So is a partnership with Baby's First Test assumed after the end of the grant? A partnership can definitely be discussed, whether we have a grant relationship or not. I think that just kind of depends on our individual goals and needs. We love partnering with anyone under the sun in general, and so if someone wants to start out as a challenge award and see how that goes, and then see if they want to partner in the future, that's definitely a possibility. We're always happy to think about different avenues for partnerships. So that's definitely something that we can talk about. It's not a requirement, but I think when we're all kind of doing similar work, it just makes sense. We love to point to community-based resources and disease advocacy organizations after individuals come to Baby's First Test. So thinking about how that might work is definitely appropriate. Okay, does Baby's First Test have some partners that could potentially be beneficial to the submitting organizations that would increase our ability to succeed at our proposed grant? I don't think that we would ever say, you need to partner with X in order to be considered for a grant. One of the things that we do look for is the submitting organization, do they have the capacity to complete whatever project it is that they're proposing? So if the organization is, one person and they're already taxed with all of their outreach and education opportunities that they're trying to do, and we have a sincere question if they would be able to take on, a project of the magnitude that we're proposing, that might be a conversation that needs to take place. But I don't think that there's anyone that we would expect an organization to partner with or anything like that. We've had great relationships with different organizations in the community, March of Dimes, APHL, a number of great groups, but I don't think it's necessary to partner with someone to be considered for a grant. All right, that's all of the questions that I'm seeing coming through. I will stay on the line for a few more minutes if anyone else has any questions that come up. Of course, feel free to email me, elizabeth@babiesfirsttest.org. I can't reiterate how excited we are about the Challenge Awards. It really is a pleasure every year to work with such an interesting group, and our only wish is that we had additional funding for all the ideas that we get, because they're really just incredible. It's great to see so much innovation in the newborn screening community. So I look forward to reading your proposals. Thank you for joining us. Again, I'll stay on a few more minutes, but I think that is going to be the bulk of the webinar. I will go ahead and post all of these questions on the Baby's First Test website, in the next few days. So thanks for joining us, and have a great day.